live, because we are doing Insta live also and YouTube live also. Today is Valentine's Day, so happy Valentine's Day to everyone. My wife is also in Bombay, to happy Valentine's Day to her also. So let us start with a question answer session, and whatever questions which have been not taken in the last session, you can always ask me, so that I'll be able to answer that properly. Just finished my OPD, so we were just trying to just see the patients that they have done with the medicines and all. Now, today's Valentine's Day, so I'll just take one topic which is very, very important, that is lovesick. The patient appears to be lovesick. Now, lovesick means what? In Hindi, pyar. He did not give the love as expected. Mayur, welcome. Nitin, Dr. Babel, hello. Lovesick. So don't always take lovesick only where there is love between a male and a female. Lovesick could be that the patient, I had a very interesting case, of a child. The child basically used to miss his parents because he was staying in a crush and the parents were working. And the whole case taking, I found that he was lovesick, that the amount of love the parents gave to his friends, their friends and all, he did not get it. So he was feeling that why don't my father and mother keep me at home, or why do I have to go to the crush? He was absolutely feeling lovesick. So after taking few other symptoms, I gave the patient the remedy peppermint. Don't always think about entim crude. Entim crude is definitely a remedy for lovesick, but don't always think about entim crude. Okay, I gave the patient peppermint. Peppermint, if you open Boric Mater Medica, it's a very, very interesting remedy. Amelioration of pain for a time by diverting attention. Open Boric Mater Medica. Peppermint. Amelioration of pain for a time by diverting attention. Now, how will you interpret this symptom? That is very important. Now, whenever the patient used to ask the parent that while you are putting in a crush and you are going outside, the parent used to tell, okay, let's go to have an ice cream, and they used to open the fridge and get the ice cream. And when they used to eat ice cream, the child used to feel happy, fresh, and everything used to forget. So the parent told me that we give ice cream and everything is okay. That means maybe the child had that temporary part, but no. This symptom I took for prescription, lovesick and amelioration of pains, whatever the patient suffering from mental pain, physical pain, is better by diverting the attention. And peppermint, I just gave 30 potency and after a month repeated 200, and that treated the case very well. So lovesick. Lovesick is again a very, very interesting rubric. Don't always take the love that is male and female. There are a lot of other things you love, so you can take that rubric. So lovesick, of course, entim crude is the first remedy. Second, you can think about peppermint, and third, which I have seen in my practice, is hydrogen. Okay, so I hope you have got this rubric very well, Dr. Babel, after a long time. Shubhangi says, hi sir, please tell indicated remedies if patients have chronic typhoid with dropsy, especially of left leg. See, whenever you got Dr. Bharat, so whenever you are treating a case of typhoid, now in today's, if you get very difficult to get case of typhoid, you can say per se case the titer is very high, increasing titer, but whenever the patient complains about typhoid, and if you think that the patient is suffering from swelling of left leg, then 2 or 3 remedies are very, very important that I can think about now, because these cases I have got very few in my practice. First, think about lachesis. Second, think about rustox. And third, think about agaricus muscarius. You can also think about gelsemium, but in gelsemium with the swelling there has to be trembling also. Okay. Peppermint, 30. The first dose I gave 30 potency. Normally I started with 30. The next month I gave 200, and the patient is better with that. Sir, kindly tell some medicines for breathlessness after little exertion. I always tell that if you are if you are basically following me, and if you have understood my way of teaching and my way of practice, I always want some symptoms more to arrive at a specific remedy. Otherwise, you can just open the repertory, open the Mathematica, and just go to the chapter respiration. You can get lots and lots of remedies. But I have seen in a practice that if you are able to give me a good symptom, I'll be able to give you remedies also, which will help in your practice. Otherwise, you can think about arsenic or phosphoric acid, phosphorus, calcarea, carb, rust ox, picric acid, sponge, a lot of remedies. Hypothyroidism, hypothyroid can take alfalfa tonic. Why you want to give alfalfa tonic for hypothyroidism? See, in hypothyroidism, there are common symptoms of breathlessness, dryness of hair, falling of hair, mood changeability, constipation, bloating. So, if you are treating a case of hypothyroidism, if your remedy is right, automatically the patient starts, getting better. You check in hypothyroidism, always the hemoglobin is on the lower side. And when the thyroid starts getting better, automatically, the patient starts feeling better. The hemoglobin increases and everything is okay. So that I don't think there is any need of alfalfa tonic to have hypothyroidism patient. But if you want, you can give alfalfa tonic. There is no problem, I think. Sir, can homeopathy cure adrenaline rush in 11-year-old boy? See, whenever you are treating a case in homeopathy, as far as if you ask me, I would say disease diagnosis is not so important, rather than symptom is very important. And I would like to add one thing that, sometimes we only have symptoms, but basically in a Mathematica, those symptoms also are in relation to the disease. For example, if the patient complains about excessive thirst, the patient complains about excessive urination, the patient complains about weakness. Now, these all symptoms are of diabetes mellitus. So maybe the symptoms are there, but at that time the disease was not diagnosed. That's why the patient had this symptom. So in homeopathy, symptom is very, very important. If you are able to ask me symptoms, I'll be able to give you a better answer rather than just a disease, just a diagnosis. That will be difficult. So forgetting names, key wallet. See, there are a lot of, if you see forgetfulness, okay, we'll take that. Now, forgetfulness is also one of the symptoms of hypothyroidism. So first check whether the patient is suffering from a primary disease or not. Now, see, in your Mathematica or in your repertory, there are rubrics that forgets the well-known street, forgets the names, forgets the places, forgets dates. Now, if you ask me, there are remedies, there are rubrics, there are symptoms, but if you take forgetfulness in general, the grand rubric, automatically you get that remedies in that rubric. Then if it is very, very specific, I had a very interesting case. The patient told me, sir, I cannot remember name. Sometimes I forget my name also. And then I took that rubric, that loss of memory for name. Of course, I prescribed the patient Calibrom. It was a hypothyroid case only. And with that patient, with that Calibrom, gradually I started 30, then 200, then went to elimpotency. And now his thyroid, which was past 10 years, he was taking 100 milligram tablets. Now he is off the thyroid tablets for the past 2 months. If you are following me closely, I have posted few cured cases. One of the cases was of hypothyroidism, where the lady was taking tablets and now she's off tablets for 3 to 4 months. We have got fantastic results of hypothyroidism. You can contact my assistant who are with me, and they will also tell you that we have very good results with hypothyroid cases. Okay. Shubhangi says, sir, thanks, great. You please tell about Brata, Ars and Mure as well. Okay. Vishaka, good afternoon. Hypothyroid can be cured. Yes, it can be treated with homeopathy. One patient is having unusual laughing every minute, involuntary and loud between normal talks. See, there is a very interesting rubric in our repertory: laughing, talking while. Laughing, talking while. laughing hysterical. So whenever these type of laughing talking while, most of the cases which I have treated in my practice, the remedy I given is belladonna. But in your case, two rubrics are very, very important. That is laughing uncontrollable, laughing trifles at, and laughing hysterical. There are three rubrics that you should consider. For example, if you consider these three rubrics, like for laughing hysterical, laughing trifles at, and laughing on uncontrollable, if you repetize all these three rubrics, one remedy is very common in all the three rubrics, and that is crocus sativa. Otherwise, you can think about stramonium, you can think about hyoscyamus, you can think about ignitia, you can think about arsenic, you can think about belladonna also, you can think about, I think, moscus also. So then you have to differentiate what rubric you have to take for prescription. In homeopathy, the rubrics are so close, if you only prescribe on those rubrics, then you will end up in trouble. Otherwise, there is one more rubric, which I think you should take care of. That is laughing involuntary. So all this, if you try to add, then you will get 4 or 5 remedies: crocus, hyoscyamus, ignitia, cannabis, stramonium, belladonna. And if you enter from this case, then you have to basically, like for example, belladonna. Belladonna has anger which is very, very temporary. So then you try to, with the knowledge of Mater Medica, try to give the remedy what has come in your repertory chart. Last say would always be Mater Medica. Okay? So Zenith is nice. Laughing, yes. So something good for laughing. I hope whoever asked the question, if you feel that the answer is done, just tell me that the answer is done so that I can go in some other rubrics and then we can discuss some other cases. So I was just telling you something about laughing. Now, homeopathic rubrications, are very, very close to each other. Sometimes it becomes very, very difficult, to differentiate between, rubrics and all. So in this case, you have to, there's one rubric called as laughing easily. Dr. Nathan, I have already told the remedies for breathlessness. Okay, already told remedies. So you can go, if you have not understood that, you can again see my live and you will be able to understand that. So I was just telling you something about laughing. There's one more rubric you can add for laughing, is laughing easily also. So we have that rubric also for laughing. So in homeopathy, once you cure a case, and then you are basically telling in front of a big seminar that I took that rubric and you have to take this laughing, we're very happy. But very difficult in your OPD to tell you that you have taken the rubric laughing involuntary, this is the remedy, and this remedy will cure the case or treat this case. So homeopathy, basically, when you're only stuck up with a rubric, don't take it, go to some other thing. We have a lot of symptoms in the whole body where you'll be able to get into the remedy, because once you take a primary rubric, you have entered the case, then you can't change it, because otherwise there'll be a problem in rubrication also. I hope you understand what I want to tell you, everyone. Okay, so let us go forward. Exertion. If you see my YouTube again, you will be able to understand that I have already told you something about exertion. Go and again check today my YouTube. You'll get, see, these are all generalized questions, so we'll not waste time. Respiration is difficult type of exertion. You have remedies in arsenic, lacacious, natramur, sponge, picac, lot of remedies. So I want you, if you ask me a question, respiration difficult after mental exertion, then that is a good question. Otherwise, in case of asthmatics or COPD, laughing exertion on slight exertion causes breathlessness is a normal symptom. That's why you should ask the question, respiration difficult after mental exertion, and then the remedy becomes pulsatilla, cuprum metallicum, and cocculus indicus. My dear friend, this is how you have to enter the case. Okay? Can Staphylococcus aureus be rebellious? Please, Didi, carcinosin and Staphylococcus aureus rebelliousness. Now, again, a very good question. So, first of all, why a patient becomes rebellious, that is very important. Now, carcinosin and Staphylococcus aureus. Carcinosin, whatever I have learned in my practice, is never rebellious. Staphysagrina is. Staphysagrina is. In fact, if you go to the rubric or remedy where there is violent anger, what is a violent anger? The remedy is Staphysagrina, but not carcinosin. Now, carcinosin is like a bonsai plant. Whenever the plant grows, you cut the plant, it becomes a showpiece. So basically, carcinosin becomes a showpiece. Everybody is pleased, everybody is happy, happy to talk to him, to see him, and the patient is happy. But Staphysagrina is syphilitic also. So anger is violent, the patient is rebellious. That is the basic difference you have to understand between Staphysagrina and carcinosin. There are a lot of other differences in Mater Medica, but this is the basic crux of the case. Okay. Okay, 10:30. So you can contact me on my other WhatsApp number. I say will tell the remedy for pain. Okay. Sir, which remedy to think of when patients have urticaria? Only when that are in contact with cold water or cold air or any cold surface. Now an interesting question. Urticaria again, urticaria. If you see, whenever the patient is exposed to cold, like for example, cold weather, cold bathing. I have had cases where the patient is aggravated from bathing in cold water. I think if I am not wrong, the remedy is calcarea phos. Please go and check it. Bathing in cold water which aggravates the complaint, the remedy is calcarea phos. How much thermal is important? See, in homeopathy, all the symptoms from head to foot is important. Depending on the gravity of the symptom the patient is suffering from. Remember my sentence, depending on the gravity the patient is suffering from. The patient comes and tells you, sir, I cannot bear heat in any form. Whenever there is summer, I have to have AC on, I have to have AC in my car, I just cannot bear it. I have to wear very thin clothes, not even any heavy clothes. You please take the rubric hot. In the same way for chilliness. If that is the identifying feature of the patient's personality, please take that rubric for prescription because that the patient is suffering from. Second thing, please listen to me. If you are confused and if it is very normal, not so important, don't take hot thermals, because if you take thermals and if you take the rubric hot, thermals hot, all chilly remedies are gone. If you take take the thermals thirstless, all the thirsty remedies are gone. So if you are very sure about what you are taking for the prescription, as Hahnemann says in aphorism number 6, unprejudiced observer, then only take that for your prescription, otherwise omit it. Let me be very clear, don't be in a stress what symptom to take, the patient is not telling anything. There are so many symptoms from the hair to the nails of the foot you can take for prescription. I've always told you non-verbal communication, like sleeping position, like perspiration, like skin, like hair, stools, urine, discharges are very important because that the patient does not think. If the patient comes and tells you, sir, I am an angry personality. No, I become angry very fast. And somebody associate tells you, no, he's not so angry. So you are confused what to take, what the patient is telling or what the associate is telling. And which type of anger to take, anger, violent, anger, this, malicious, lot of things. So you can confuse in your interpretation. But when the body is telling you in a non-verbal way, then that symptom becomes more important. That's what I see in my practice. So patient complains of dry, scaly, lower limb, skin, itching aggravated by touch, midnight, followed by burning, bleeding, better by cold, routine indicated not working. How should we proceed? Complaints with time modality are daily. Yes, Dr. Barbell. I forgot to tell you, 14th February is a very key day for me because I had started my international webinars on 14th February, I think 4 years back. 2 years back, as Dr. Babel writes, I had the pleasure of all German doctors coming and visiting my clinic. And last year, 14th Feb was my visa date, and in April I was in Germany. So 14th Feb is really a very interesting date for me. So let me get back to the question. Yeah. So see, whenever you are treating a case of dryness, now remember that it is not always, but in my practice, I have seen especially dryness of the body, especially of the limbs, of the extremities. Don't go rubric wise. Why is the dryness? Why is the dryness is very, very important. The first thing is either there is dryness of emotions, or there is nutritional loss of, or there is not even quantity of fluids which the patient is taking. And then you can go and then understand why the dryness is the patient is suffering from. Very, very, if you have already prescribed the common remedies, I have seen very, very infrequently used medicines in dryness which have got good results. The first I would name is anacardium. Anacardium patient is a patient who takes everything in the bad part. There is a lot of dryness, no friends, no emotions, no emotional connect, brattacar. Of course, sulfur is there, calcarea phos, sulfuric acid, natrium ure for dryness. So you can enter the case from this and then you can proceed forward in the case taking. Abdominal pain while walking and aversion to spicy food, especially condiments added. What to think old age female patient? Yeah. So pain in the abdomen while walking, aversion to spicy food, especially. So see, if you are basically treating a case of pain in the abdomen and the patient does not like spices, you can just take pain in the abdomen because of eating heavy food also. Simple if you keep it. And the patient has old age, and if the patient is not taking non-vegetarian, so he might or she might have a deficiency of vitamin B12. So that's why you can take the rubric like you can take the remedies like of course the common remedies Naxomica or China or Lycopodium are there, but I have seen in my practice old age, pain in the abdomen, walking aggravation by spices aggravation, strychnine phos, very, very important. Strychnine phos, my dear friends. Sepia, my dear friends. Third, you can think about ferrum metallicum, and you can think about sepia also. Yeah, I hope Dr. Babel, we can again meet. Either y'all can come to my clinic or I can come to Europe and have one seminar also. So let us go forward. I think some questions have scrolled up because there were a lot of questions and I took time to answer the questions. And Dalkama you recommended for my friend article exposed to cold aggravation, cold water. Yeah, cold. You can think of Dalkamar also. You can think of calcarea phos also. And if I'm not wrong, you can think about Artica urens also. That is also there. Sometimes I can also forget extempo mater medica. Sometimes become difficult. I have to think at that time. So you can think of these remedies. Yeah. Hope I'll come to Europe again. Sweet line, phosphorus, stinging nail. Okay, so let us go forward. I hope most of the questions are answered. Let us go forward. Now, if you are done with laughing, I would just add one thing. I had a very interesting case, and the patient, when he was laughing, I did not like he was laughing. It was like making fun of me or inciting me, or the laughing I did not like. So I was thinking what rubric to take for this, whether to take inciting, whether to take XYZ, but the symptom was laughing. So whenever the patient was laughing, it was hurting me. I did not like that. So I was thinking what to take. While speaking, he was absolutely fine, so I could not take that the rubric of inciting me. But whenever he used to laugh, I used to feel very angry, and I used to get annoyed with that. So if I ask you the question, in your OPD, if you get some cases where the patient is laughing and you don't like it, you feel annoyed when he laughs. What symptoms to take for prescription? Anyone? What symptom to prescription, and what remedies that comes to your mind? Sometimes the mathematics is in front of you, the remedy is in the front of you, the patient is actually telling you that is the remedy, the patient is behaving like a remedy, but you are not able to interpret the symptom. Homeopathy is all about interpretation. So whenever I gave the remedy to the patient belladonna, there's a beautiful symptom in belladonna, the laughing annoying. Whatever symptoms I was experiencing, whatever aura which I was experiencing when the patient was sitting and laughing in front of me, I just took it that symptom for prescription, laughing, annoying. And to my surprise, in the repertory also there was only one remedy, and that was belladonna. And belladonna was able to treat that case beautifully. Okay. Inciting is a rubric. Yes, my dear friend, inciting is a rubric. Repertory is all about inciting others. Others may, the doctor also comes, So inciting others, the only remedy in this rubric is hyoscyamus. Okay. Kindly tell some medicines at the time of emergency when there is severe pain in the stomach. See, whenever if you have an emergency condition and whenever there is severe pain in the stomach, just ask why is the pain. Maybe he has eaten some outside food or whatever XYZ. There are 3 or 4 remedies which I have used in my practice with good results. Colocynth, Naxomica, Allosocratina, Macphos, and Pulsatilla. So one of the reasons, of the pain in the abdomen, if you get it, and then you can prescribe. Okay. Is that okay? Anyone? If you feel okay, then you can always tell me something, so I know that this question is taken care of. Otherwise, I can go forward. For emergency condition, I have to only tell you about 3 or 4 remedies. If I tell you the whole Mathemedica, you will be lost what to prescribe. So I am just telling you the important remedies that you should keep in your mind, or you should keep with yourself. Headache while coughing, homeopathy remedy. Oh, this is very common, This is very common. Anybody can give the answer. Headache with cough. Headache with cough. Yes, anyone? You can think about 2 or 3 remedies which are that comes to my mind. The first remedy that comes to my mind, headache because of cough. Yeah, you can say the patient coughs and sometimes it headache, sometimes there is no. Anybody? You can think about sorainum. Sorainum is a very, very interesting remedy. You can think about sorainum, or you can think also about lachesis. Yeah, you can think about Brian also, but whatever remedies I have took. Difficult to look, to hear, to write and translate. Yeah, I think Dr. Barbal is talking about me or the patient. Difficult to look, to hear, to write and translate. Yes, okay. So in a patient, if a patient is in front of you and if you have a problem of interpreting the symptoms, normally what I do, then I tell the patient, okay, the case is done, you can go out, and then I open my books or the repertory or the program and look for what I want from the patients. It's absolutely okay that sometimes we are not able to understand the patient's language. You can put in the repertory and understand what remedy to give. I do that, not sometimes in front of the patient, because sometimes the patient feels that, oh, the doctor does not know how will treat me. So tell the patient to wait outside, and then you can always open your books and understand. I think there is nothing ashamed of opening the book and understanding that. That's what I feel. A sexual aversion desires true caressing, feels unsupported, offended easily. See, whenever if you have this type of symptom like offended easily and these personalities basically are very sentimental personalities. They are very, very sentimental personalities. Now then you have to go to understand what are the sentimental remedies for that. For example, we have antium crude, we have ignitia, we have phosphorus, then we have nitromure, selenium. These are all sentimental remedies. All the remedies have aversion to sex. So, you see, aversion to sex basically is a mental state. So if you're very sentimental about something and you take that important symptom, you can have develop some other symptoms also because of that. So you can always go to the rubric sentimental remedies and then go to the mathematics and prescribe the remedies. Okay, I think it's all over. It is already half an hour up, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Bye.